Welcome everybody to our new episode of Ocular Insider, now in a beautiful place of Copenhagen with a nice guest we have today, and it's Dr. Samy from Egypt, Cairo.
Correct.
She's the doctor from Watani Hospital, working also in private with Dr. Asaf for dry eyes. She's a dry eye specialist. She's the founder of the Dry Eye Association.
Dry eye department in the Watani Eye Hospital.
She's a cataract refractive surgeon, ocular surface specialist. So I'm very happy to welcome you today here in our new episode, and hope you will enjoy. So Dr. Samy, tell us a little bit about yourself, about the passion for.
First, thank you for the introduction, and I'm very happy and pleased to be here. For what I'm doing, I'm running the dry eye department in one of the most busy city in worldwide and in Egypt. We have a lot of dry eye patients and ocular surface disease patients, and I believe this is attributed to the atmosphere and for the global impact of the screens and makeup use and the health and the non-healthy lifestyle that we are living every day.
Yeah, I know that we already discussed a little bit before in many other meetings, and I'm very happy for your knowledge you're sharing. I know that you have a lot of patients done and presentations. During these discussions, I found that you have very nice knowledge, and that would be very nice also share with the audience. How you feel the impact of the beauty part of women worlds, which is far away from mine, but I see with my wife, of course, and the beautiful women like you. So how you feel the impact of the colors, mascara, the makeups? I see there is a correlation we see with our patients. So what is your experience?
Actually, this is a very interesting and important topic. And the idea to correlate the ocular surface dry eye and bridge them to the aesthetic medicine is very important and crucial. And we cannot just go blind and hide our eyes about what's going on in the makeup use and in the cosmetic products that people can use, or even just ask them to discontinue because we're not being practical and we're not going anywhere. But the thing is to teach and educate patients, spend some more time to help them know how to use things properly, what is good and what's bad for their eye health.
So what are the symptoms you see or make patient recognize with the choosing, for example, the bad makeup or having the bad habits that I believe they're coming from the bad habits?
Like, for instance, if you're seeing a patient for the first time, and especially if it's a lady, you have to ask them about the eye routine that they're using, the products that they are using and how they are using it. So some like the creams around the eye surface, the makeup, the mascara, the expiry date, if they are aware of that, the eyeliner, the eye pencil, and where exactly they're using it. For instance, the eye mascara, if they're using the waterproof mascara, which is very hard to be removed, it blocks the meibomian glands, obstructs the glands, and causes their atrophy later on, which also will cause inflammation on the eye surface. And sometimes the patient have this awareness that they are visiting the doctor and just to remove everything, and you're not going home with them. So you have to address these questions directly and ask them what they're doing at home and when you're not seeing them. And it's very important and beneficial, as I said earlier, to educate them what to use. Like, for instance, makeup remover, either eye makeup remover or even the regular ones have surfactants. And of course, you don't want to use or put surfactant on the eyes. So it's better not to use this and use the natural ones. Also, the mascara, it's better to be a water-based and waterproof mascara. It's helpful. And to avoid using eye pencils and eyeliners inside the waterline, where are the puncti of the meibomian gland orifices.
Is there any symptoms that maybe the user of the mascaras or pencils can see as the first initial warning signal? Yes, something is wrong.
Sometimes they have stinging, burning, but this is if they're using a very bad quality. The thing is, this takes some time to happen. Like if they're using good quality, but they're using them in a non-proper way, they have some time to experience symptoms and side effects of that.
Would you also comment that once they start crying more, that is already getting in the worst case?
Yes, this is one of the things. Also, checking the expiry of not just the expiry of the date of the first use of the mascara and for the eye makeup for general.
I know that you open it, you put in your bag, and then you just
You forget.
You forget when you start to use it, and this is my favorite one. I'm using for 2 years.
Exactly. And I always ask the patient to get these sticky notes, the small ones, write the date and just stick them on the back of your mascara or eyeliner.
What's a nice trick? I put it on a foot in my fridge.
You can do this with the eye makeup as well.
So, what is interesting, I know that you've been in this industry having a lot of experiences. What are then protocols that you would advise for once the patient comes with already developed symptoms and the problems coming? Is there any particularly you started on beginning and then you follow up?
As doctors, we always start with history taking, and it's important to address the things you want to ask about, like any aesthetic things or even surgeries they are doing. Mm-hmm. We cannot forget about the botox, the blepharoplasty, because they affect the blinking dynamics, even if we don't see any lag of thalamus or incomplete closure of the eyelids, but the blinking dynamic is different. We also want to ask them and if they're doing the eyelid hygiene, and if not, we have to educate them how to do the eyelid hygiene and to clean the lid margin on daily basis, and never to wear makeup while sleeping or forget to remove it properly. We have to educate patient. Like the first line of treatment of dry eye is to educate patient. And educate patient for dry eye and educate patient for a healthy ocular surface, and that pretty eyes equal healthy eyes.
Mm-hmm. Do you see the changes in the age of population having the problems? I know it's very visible in the street, more and more young girls using the paintings. I think should be also part of the schooling in school. Yes. I know that they are sharing everything on Instagram and TikTok, and you are the one of the big star definitely there with your sharing the knowledge. How is this in Egypt?
This is like it's everywhere in the world. Now girls start using makeup sometimes by the age of 10, 11 sometimes. And they say, or some mothers claim that it's like kids friendly or children friendly, but you cannot trust that. Mm-hmm. And it's, of course, we have to ask them to discontinue because it's too early and they're affecting even the skin. And also these children will not be aware of how to use the makeup and that it's personal. They cannot share them with other friends, how to clean it, how to maintain, how to check for the expiry. I'm not sure if they can do that. So it's better, of course, to avoid this. And also, what we cannot forget that at this age of starting adolescence, they have some acne and like not a less number of not few number of children are using isotretinoids, which also affect the ocular surface.
Definitely, it's helping stimulate the dry eye.
Exactly.
So when you reach in this topic and this point, what is your experience with the younger age patients for treating the MGD?
First of all, we have to educate them, as I told them, to avoid the risk factors, and you can do IPL. It helps a lot. It helps if the patient is indicated. Mm-hmm. It helps for treatment of the rosacea. Some children, they come with repeated chalasia, and the reason behind sometimes is that they have ocular rosacea, which is also an indication for the IPL. So yes, it's
we see also for protocol for our machines, we always communicate with parents probably, because the children cannot decide it by themselves for this kind of medical treatment. How the parents are understanding the procedure?
First, they got scared and terrified and asked. But if you have the knowledge enough to to convince them, to show them cases, to show them the tear film analysis before, and to get them to be aware of the children's eye condition, they will be cooperative with you.
I'm getting these questions all the time. So how we can prescribe the children treatment? So what are the difficulties, when you need to perform, for example, IRPL treatment? What are the basic steps that you do with this teenage?
First, we have to spend some time with the child to make them understand what's going on, because we don't want them scared. We don't want them to have any kind of disagreement or being pushed by the parents. You have to educate them. You can even have some videos on your phone that you can show them the procedure and how it's easy. It's an office procedure. It's not a surgery, and you feel no pain. You will see we will put you. I tell them exactly.
Do you see the difference between the girls and boys?
No, it differs.
I was hoping that you say, "Oh, boys are more scary."
Yes, I don't want to say that, but men are more scary, not most of the time.
We are definitely the weakness part of the population.
This is true.
Yeah, sure. So it's also you see that also these girls are more, let's say, sensitive to the dry eye than boys.
Because of the makeup use and because of the hormonal changes that they experience also in this age, yes.
Yeah, then is also following in the next generation. So it's true. It's a genetic part that our body is constructed, and definitely also beauty part that we want to be beautiful, wants to be attractive for the others. Yeah. And the second part would be. Definitely, like you said, the education should start early beginning, to be educating. This is something that you should do, of course, if you want to, but there are some risical factors. Do you think that the companies that produce these products are aware of all the aspects, or they just close their eyes?
I'm not very sure, but I think they're not eye doctors. They are not, I hope they are not aware of what they're doing. And the thing is not just that cosmetics are bad. I use cosmetics, but I even show the patients where I put cosmetics. I put them, just don't put inside the lash line. Just take care to remove the eye makeup every day and to clean the lid margin. It's not 100% bad, but you have to know how to use them.
Yeah, I'm also seeing there are also good companies. They are also in ophthalmology very active, I see your story.
Yes, correct.
I'm sure that you are communicating very close, which is also very interesting because as a TIFOS member, you are very close to these products. Is there anything that you would give as a last, let's say, conclusion of this very interesting topic? And I believe we could talk more and more ship would come here.
Let's wait for the ship then.
It's coming. So is this something that you would like to also in the future add to your new, let's say, ideas that would be helping the young population and also the population of the women who definitely still want to be more and more beautiful, to give your advice?
Just to know that I cannot be more beautiful if I'm not healthy, and that pretty eyes equal healthy eyes. And what I'm not experiencing now, if I'm doing something wrong, I will suffer from it later. So it's better to be cautious and healthy.
Great. Thank you so much. Thank you, Dr. Hamsamy,
for
being our guest in our Ocular Insider taken here in Copenhagen during the ESRS meeting this year. And I hope that I see you in next future meetings or maybe in Cairo again.
Sure, it's my pleasure.
And we can open a different door for a knowledge of yours. And I'm sure that we will have a lot of new things to discuss. And thank you so much that you accept our invitation for this Ocular Insider. And have a great day in Copenhagen and in Denmark.
Thank you, Peter. Thank you.
You're welcome.
Thank you.
Thank you. Thank you so much.